Good morning. This is Rick Gleason and Don King. We're coming to you from the heartbeat of worker health and safety from our studio at the University of Washington. We are coming to you today from the Region 10 OSHA Training Center, and we help out in Washington, Alaska, Oregon, and Idaho. And today we have a special guest and a special subject that's very timely. So, Don, can you tell us a little bit about our guest?
Yes, as a matter of fact, Dr. Vorvick is up in Arlington, Washington, at a clinic, and the outreach people were kind enough to give me her name and that she would be happy to talk to us about heat stress and prevention and that type of thing. So we really appreciate having her here. And what I'm going to do is have her introduce herself and explain a little bit about what happens in her clinic up there on a daily basis with heat illnesses. So, Dr. Vorbeck?
Great. It's nice to be invited to talk about heat stress. I'm Linda Vorvick. I'm a family physician, and I work at the University of Washington Neighborhood Smokey Point Clinic. We're in Arlington, Washington, and we're in a community that is both has a significant amount of farming and outdoor work to the north of us in the Skagit Valley and in the Arlington area valley, and then we're about an hour outside of Seattle, so we also have a lot of people who are workers in Seattle and Everett, and weekend warriors, and mountains to climb, and bikes to ride, and kayaks to kayak, etc. So we have a mix of people who work outdoors, people who play outdoors, and in the summer, heat stress is a very important topic. What would you like me to start with talking about heat stress?
Well, what I think is most important is for people to really understand some of the symptoms that they are going to have and be aware of what they need to do in order to prevent it from getting worse, Linda.
Sure. So one of the important features of heat stress is to think about who's at risk for trouble in the heat and what kind of heat is a big problem. So there's actually tables that the government puts out with the amount of humidity plus the amount of heat that gives you how likely you are going to have heat stress being outside. And it's really important that if you're working outside or exercising outside for fun, that you be acclimatized to working and exercising in that environment with that amount of humidity and that amount of heat. Humidity is a problem because it keeps the body from dissipating heat through sweating as easily as dry environments or environments where there's wind. So a warm, humid, still day is more dangerous at the same heat as a warm but windy and not humid day. So those are some of the factors to think about when you're going to go outside to exercise, or if you have to work outside. And if you can reschedule to a different day, can you reschedule to a day that has to a time of day that's a little less hot would be all great things. The things that people start feeling with heat is heat exhaustion. You're tireder than you think. You feel tired, you get a headache, you get fatigued, you can't do what you think you're going to do. You start not functioning well with your thinking. So you start to make bad decisions for yourself. So it's important not to get to the place where you start to have trouble thinking and then you can't decide what to do, so then you end up staying out in the heat rather than getting yourself help. What you might notice is, if we came to look at you medically, would be your heart racing, tachycardia, your blood pressure being too low, that you actually look dehydrated. And then when we would take your body temperature, that your temperature would actually be going up, your core temperature going up. So that's the major signs of of the sort of heat exhaustion. There's other things that happen in the heat, like muscle cramping, or your legs will sometimes swell. You get more edema in the heat because you have more blood flow to your skin, and those are things that are uncomfortable, but don't necessarily lead to heat stroke and heat exhaustion itself. Those are much more manageable conditions.
So, Dr. Vorvick, if I'm going to take a little hike or I'm going to be working outside, and I know it's going to be a hot day in June, July, August here, how much water should I be thinking of taking or bringing or drinking? How much do we need?
So it turns out, for water, that's a really great question, and it turns out that you can lose um, up to 1 to 2 liters an hour of sweat if you are really well tuned for working in really hot environments. Your sweat glands can lose water really quickly. So you need you need as much water so that you come back with water in your water bottle. So that's kind of a silly answer, but truly it depends on the condition so much. So you need to take more water than you think you're going to need is the bottom line. And then with the water, if you're going to be out for a long time in the heat, you need to take salty food with you, because with all that sweating, you also lose salt. And salt tablets actually don't work as well as salty food. So I know hikers who will take single packs of potato chips, and because they're lightweight, and then they'll crunch them all up into basically little pieces so that they fit in their pack and don't take any room. And then that's what they eat when they're hiking.
Hey, good advice. That makes sense. So, but good point that we shouldn't be asking our medical doctor for salt tablets so that we can take those. We probably get enough salt normally, but having that little extra in food certainly makes sense.
Yes, so when you're exercising, you need the water, and if you're going to be gone a while for a longer period of time and need to be eating, then you need to be eating something that has a little bit of salt in it too.
So we often talk, we have, obviously we're in the construction business, which is the majority of the individuals we interact with sometimes. We often are trying to discourage them when it's hot out to take in too much libation, as in the Budweiser. What effect does alcohol and caffeine have on getting yourself into heat exhaustion?
Well, both of them are paradoxically a little dehydrating. So even though they come in liquid form, they don't actually replenish the liquid your body needs. And so in the metabolism of alcohol and the effects of caffeine on diuresis. So while if you were in the middle of the desert and that was the only thing you had to survive, that would be the recommended liquid. It's not the recommended liquid when water's available for you. So water is much better, and the message I just gave earlier, water with a little bit of salt in your food, is much healthier for you. And the difficulty working construction, etc., is that you can get dehydrated over multiple days. So, day one you might be fine and drink a lot. Day two you might be fine and drink a little less because, you didn't have any trouble yesterday. So you don't drink as much water day two. Day three, you forget to drink much water. Day four, you work hard. And then Friday comes along and it's an extra hot day and it's extra humid. And then you're now, and you've gone out with your buddies after work every day that week, and so now you are cumulatively dehydrated over several days. And so you hit the hot, humid day with no wind, and you have to wear all your safety gear and everything, so you can't sweat as easily as you can to get the heat out of your body. And now all of a sudden, not only do you need the water for today, which is a bad day for heat exhaustion, you need to replace the water you've lost over the last couple of days. So you're starting out behind.
Okay.
And that's the major concern is most people who get severe heat exhaustion, heat stroke, it's because they get accumulated dehydration over several days.
Oh, that makes sense. Do you get quite a few construction people in your clinic with heat exhaustion?
I have definitely I have sort of quite a few of every kind of person in my clinic. It's been really wonderful here. So yes, I took care of a person who had a wrist problem yesterday who works in construction and wanted to get back to work as soon as he could, and so needed to see me right away when this wrist thing came up. So yes, I do, and I actually did construction myself as a college student. My father owned a construction business, and I worked for him through high school and college.
Oh, excellent. Well, that helps a lot when you're treating these gentlemen and ladies because you understand what they're up against.
Absolutely.
Boy, this is great, Dr. Vorvick, and also to have you as part of the University of Washington as well and your medical clinic. I'm so glad that we were able to get you and your perspective. We just wanted to end the show today with the State of Washington Department of Labor and Industries Division of Occupational Safety and Health has an outdoor heat related illness rule, and it goes through the throughout the state of Washington through the 5 hottest months, which they've deemed as June, July, or May, June, July, August, and September. And they say that the employer, so if you hire people that work outside in hot days, that the employer has to, at no cost, make sure they have 3 things, and that would be water and rest and shade, so that they have a place they can go to take breaks that's out of the sun, and that the employer has provided at no cost enough water. And then it kicks in at different temperatures. If it's ever more than 89 degrees outside, then every employer that has workers outside has to be following this rule. If you have coveralls on, it kicks in at 77 degrees. And then if you're doing cleanup of a hazardous waste site with chemical impervious protective clothing, it kicks in at 52 degrees, which could be all throughout the year, no question about it. They opted not to include humidity in that just because it was too complicated. So what they kind of, when they wrote the rule, and we're one of the only states that has this rule in addition to California, is that if you're driving down the street and you see a bank sign with the temperature, whatever it's reading on that bank sign is the one you'd go by. So if it's 90 degrees, it's in effect for that day for all employers that have outside workers in that area. So it kind of gets them thinking about training of their workers in things you talked about for heat stroke and heat stress and drinking enough water and how much water, but it also puts the duty on behalf of the company, the employer, to make sure that everything is provided for those workers and their safety. So we just wanted to throw that in kind of as the the end here. But if folks had questions for you or the University of Washington, is there a way they can go online, or how could they contact you or the clinic or the university?
The best way to contact us online is at uwmedicine.org, and that has a website that has all of our physicians.
That's perfect.
I'm sorry, I'm pretty sure it's if you Google UW Medicine, you will get our website that has all of our physicians, all of our contact phone numbers, and we are always happy to consult with people and have new patients.
Oh, that's great. So great. And you're up in Arlington, but the UW Medicine is throughout the whole Western Washington. Is that correct?
It's through the Puget Sound area now, from Olympia to Arlington, and then we have partners in other parts of Washington State as well. So we have collaborations with people in Wyoming, Montana, Idaho, and Alaska as well. So we're a regional healthcare system, and we're happy to help wherever we can.
Oh, that
Excellent.
is great. Thank you so much. So, hey, this has been Rick Gleason and Don King coming to you from the heartbeat of worker health and safety from the University of Washington, the School of Public Health, the Department of Environmental and Occupational Health Sciences. And Don, any last words of wisdom for us?
Well, there's a saying that if you keep on saying things are going to be bad, you have a good chance of being a prophet. And that's by Isaac Singer.
All right, that's our quote for the day. So thank you very much.
And to all of you out there, a big aloha.
I was young and feisty, never did things by the book. Just let me get my toolbox and I'll take myself a look. I climbed up on the dozer with my mechanic's pride, said, "You can keep it running, friend," while I poke around inside. Shake hands with danger, meet a guy you ought to know. I used to laugh at safety, now they call me Three-Finger Joe. Though I learned a lesson, I forgot it soon enough. The nicks and burns and scratches showed the young ones I was tough. Till another morning, I was grinding on some steel. My other hand got careless and fed my skin into the wheel. Shake hands with danger, step right up and say hello. Grinding wheels and metal are what made me Three-Finger Joe. I've seen mechanics burning, and I've seen them take a fall just to save themselves a minute. I've seen them lose it all. I've watched them courting trouble, seen them take a chance and lose. They get careless for a moment, spend a lifetime with the blues. Shake hands with danger. Shake hands with danger. Shake hands with danger. Shake hands with danger. Shake hands with danger and some friends I used to know. Compared to them, I'm lucky to be just Three-Finger Joe.